Hello everyone, it's Melissa Sweet here, public health journalist from Croaky, attending the Congress of Aboriginal and Torres Strait Islander Nurses Conference on the Gold Coast. With us we have Karen Cook from the Federal Health Department, who delivered a keynote presentation this morning, very engaging and informative, a vision for the future of healthcare and nursing in particular. Karen, could you just introduce yourself a little bit, tell us who you are and what you do?
Hi Melissa, I'm currently the Director of Innovation and Reform in the Health Workforce Reform Branch in the Health Workforce Division in the Australian Government Department of Health. Part of my work is provision of secretariat support for the National Nursing and Midwifery Education Advisory Network and some other policy work which primarily revolves around nursing roles and nursing workforce numbers into the future. I'm an affiliate member of CATSANAM and I'm a long-term friend and supporter of CATSANAM. This is my 12th CATSANAM conference, so I'm really thrilled to be here.
Congratulations. And you have a history in nursing yourself. Can you tell us a little bit about that?
Oh my gosh, so I've been a nurse now for in excess of, let's just say 35 years. Unfortunately, I'm not also a midwife, which saddens me, but it's too late for that now. So in my nursing career, I've worked in a lot of different roles. I've worked in aged care, in surgical nursing, in medical nursing. I've worked in rural areas. I've worked overseas in England, and I actually also spent a very brief stint in Rwanda a few years ago helping them with nursing regulation. I worked in regulation for many years and now I find myself doing policy work. I think like lots of people in nursing and in other professions, you don't plan your career, you just sort of find things you love and feel passionate about, and that's what you do.
Fantastic. Now, you talked about the history of nursing roles and how they've transformed over the years, but you suggested further transformation was needed, in particular nurse practitioners. You said we could be doing much more to utilise this workforce. Can you explain what you meant by that?
Nurse practitioners is a workforce that started in Australia in the early 1990s. The numbers of nurse practitioners in the country are still quite small. We've only got about 1,300 nurse practitioners, and they're largely still concentrated in the acute hospital sector. I think the issue that we've got with nurse practitioners in Australia is that we've failed to realise their true potential and what they can offer to the health services. And so I think what we need to do now is start to think about what's the best way to use health practitioners in Australia. For me, it's about primary health care, it's about chronic disease management, it's about residential aged care. You can really see where nurse practitioners could add enormous value to health service delivery, and I think we need to have a conversation about how best to use them and start to think about how best to educate people to be nurse practitioners and to start to develop those models of care.
What do you think are some of the barriers or enablers to, making it easier to use the skills of nurse practitioners?
Look, I think one of the problems that nurse practitioners will talk about is business models. So it's not by chance that we find a lot of nurse practitioners working in emergency departments in acute hospitals, and that's because they don't have to worry about the practicalities of running a business and trying to secure a revenue stream from MBS. What we need to do with nurse practitioners is find innovative ways to fund their services, and nurse practitioners need to develop their skills in the management of their business as well as the management of health.
What is your vision for the future of healthcare? You painted a bit of a picture talking about a virtual health centre in the United States. Can you tell us some more about that centre and what we might expect to see in Australia in coming years?
I think one of the things that's exciting and alarming about healthcare at the present time is the pace of technological change and then the implications of that for health service delivery. And in my talk this morning, I talked about the implications of that for nursing. What does that mean for how we educate nurses, and what does that mean for how nurses practice as nurses and within a larger multidisciplinary team? Technology is moving at such a rapid rate. It feels like we're not quite keeping up in terms of our preparation. The virtual health centre I was talking about this morning is in Missouri in the United States, and it's a virtual healthcare centre. It's like a hospital, but there's no beds and there's no patients in the actual hospital. Everything is done remotely, and so that virtual health centre is providing a second set of eyes for 30 intensive care units across 5 states. Now, the implications of that for a country like Australia are absolutely enormous. And the role that nurses have to play in that sort of work is quite important, because that sort of work, although you're collecting data and you're analysing and interpreting, you need that background, you need that education. So nurses, I think, have got a great deal to offer in that space in terms of virtual healthcare. Currently we've got lots and lots of nurses around the country using telehealth. This is taking it to the next step, which is why I come back to how we prepare nurses to work in those sorts of models of care.
So you said our nursing curriculum hadn't changed a great deal, and is it 30 years?
I don't know that it's the curriculum hasn't changed, but I think when we moved nursing into the tertiary sector about 35 years ago, we transitioned a hospital-based program which ran for 52 weeks per year for 3 years into a university setting. Now, an enormous amount of work has been done in terms of course content and curriculum delivery and so on. So I'm not saying we haven't done that work, but what I'm saying is we haven't critically reviewed what we've been doing since we transferred into the tertiary sector. Now, if you look at that against the fact that the way that technology is impacting on the role, new models of care and service delivery, it really is time we looked at it. We need to go back and have a rethink. We're hearing a lot from employers about graduates not being work ready. We're hearing from graduates that they don't feel that they're work ready. We've got to put in place a lot of transition to practice programs to try and bridge those gaps. And then we're hearing from graduates that even with transition to practice programs, they're still feeling ill prepared. And so we've got high attrition rates in early career nurses. So there's clearly some issues there that need to be looked at. And I think if we go back to the undergraduate preparation and we look at, are we educating people to be the nurse of the future? And that's what we need to do.
So is there a review planned, or what is the sort of state of play there?
The National Nursing Midwifery Education and Advisory Network, on its work plan, has this piece of work. And so they will be starting that piece of work very early in the new year.
And what will that actually entail?
Well, now you're asking me questions, Melissa. So clearly it's going to be a long-standing project. Clearly this is not something that's going to be done in a short period of time, because there are an enormous number of stakeholders involved. Education is delivered in the tertiary sector, so that's a federal responsibility, so the Department of Education. The university sector, the Council of Deans and Nursing and Midwifery, public hospital employers, the chief nurses in every state and territory, private hospital employers, they employ new graduate nurses as well. The ANMF, who would be interested from an industrial perspective, the professional bodies. I could go on and on and on, but there's a lot of people involved. There's a lot of people with what they call skin in the game in this particular one. Everyone's very interested in this piece of work. So I think it's going to take a lot of time to do this work and to do this work properly.
Is this an opportunity for organisations like Katzenam, which are great advocates of the need for embedding cultural safety much more deeply into education, training, practice systems? Is that an opportunity then, do you think, to look at that as part of the review?
Oh, look, absolutely. And I think that, I'd like to congratulate Katzenam on launching the Leaders in Nursing and Midwifery Education Network yesterday. It's fabulous that they've been able to get this up and running. Look, Katzenam have an enormous role to play, and as one of the things that I mentioned this morning is that we continue to have low commencement and completion rates for Aboriginal and Torres Strait Islander nurses and midwives. And we're still hearing that they're still suffering from real issues in terms of trying to complete their education, barriers and financial barriers and being away from home and cultural issues and all of these sorts of things. So I think that Katzenam has a really big role to play in using this as an opportunity, together with Linman, to see whether we can't do something to improve those commencement and completion rates.
And just finally, you've been attending other sessions at the conference. I'm asking a range of participants, what's their take-home messages from the conference. So what will you be taking back either to the department or your work more generally from the conference?
Look, there's a really key message for me that's already emerging from today. Chris this morning spoke about humanity. It's about humanity above all else, and I think if anything speaks about nursing, it's humanity. When Ruth was talking about technology, and Ruth went into a great deal more detail than I did about the implications of technology and the different types of technology, but Ruth also then brought that back to the broader determinants of health. And I've just been to a wonderful session on the implementation of birthing on country, and that is also, to me, speaks about humanity, and that speaks about community and the need for community to be cohesive. to achieve really good health outcomes. So far so good with the conference. I think it's like all Katzenham conferences, it's giving me lots of food for thought, and it's doing what Katzenham conferences always does, makes me cry.
Why does it make you cry?
Because I hear these stories. I've just been speaking to a woman who's been to a session on symbolism and iconography, and she's made herself a message stick and she's written her story on it. But the culture is so rich. It's just so fabulous. I started my talk this morning by talking about the past. You can't ever forget the past. You've always got to remember what your forebears have done that's enabled you to be in the privileged position that you're in today. It doesn't matter what culture you're from. And so to be standing there next to a woman who's just been and had the opportunity to sit down and paint her stick and write her story on her stick, and it brings me to tears. I just think it's a rich celebration of a marvellous culture.
Thank you very much, and I must say I also appreciated your dance moves on the stage this morning, and I do hope to have the opportunity to hear you and Janine Mohammed from Katzenham sing karaoke one day. Thank you very much.
Thanks, Melissa.